Okay, so this week, in terms of gathering information and just analyzing the situation, I definitely feel like I'm building off every week pretty well. This week, I went in there with the right mindset. I went in knowing my questions I wanted to ask. I wanted to ask this client specifically, like, when was that? I saw you had a chart for cancer. Where was that? Can you tell me when it was? I went in and asked him how he fell, where he fell, how bad was it, how bad was the pain when he fell, and what is it now? A lot of like comparing to what happened to where we are now. I feel like I did a lot of that this week. I definitely really did good on my time management this week in terms of information gathering. I went in there having my histories for medications already done. I knew this client's previous medical history-ish. I wanted to ask him a couple questions about it this week. I asked about his, what else? I asked about his, what do I call it? His surgery. I asked about his surgery a lot, and I asked about like, is there any drainage, any fluid, any changes, any new and acute symptoms? I did a really good head to toe on him. He was very compliant. I gathered a lot of information about his O2 stats and his current situation about having low hemoglobin and how he had a harder time breathing and an increased heart rate. So in terms of the pathophysiology portion, I think asking these questions and doing the head to toe assessment was very helpful in connecting the dots for this specific client. In terms of interventions, I definitely was talking to him about like, oh, when you go back home, make sure to like understand that like you might get dizzy sometimes. So if you feel dizzy, try not to get up or take things really slowly. If you notice that you're having a hard time breathing, like maybe call your wife over, have your wife educating specifically the patient just to be careful, because he did fall. Maybe cleaning up the clutter on the floor was something I should have said to him. I think that would have helped. I did educate him on eating better nutritious diets, because he said his wife cooks for him, and yes, he eats pretty clean. He was a very active guy, so I was like, all right, since you're already active, let's try to keep up that protein in your diet so we don't have these injuries, because he had an injury on his sacrum as well as his heel. So I was like, let's try to like avoid these injuries, because they were only stage 1, but they were very little, but they could develop later. In terms of care tests, I believe I was very, let's see here, I think this week it was a lot of very listening and communicating for me. Very, very one-to-one with the patient and the family. His wife was very helpful. She told me some things about how they live at home. He was very helpful, telling me past medical history, like he was exposed to Agent Orange because he was a Vietnam War veteran. I think in total this week for me, I think the information that helped me the most this week was asking the patient himself personally. Going back to the first question, I'm sorry, but I think that was really the most helpful for me this week. I definitely feel like I was more prepared going into the room, and I'm learning every week from previous experiences and learning from my peers as well, seeing how they do things. If I could tweak it in my own way, I think that helped a lot this week. In terms of self-care this week, I didn't do much. I just took a lot of naps this week for sure. I got some nice naps in, but overall I'm gonna keep adding on to what I got.